Okay, with that, I would like to introduce Dr. Sharif Elnahal, Undersecretary for Health.
Thank you so much. Let's give a warm round of applause to Dr. Anne Lord Bailey for her leadership on this work. Anne definitely taught me that this work can mean much more than video games on your free time. And it really is a lot more than that. What I can tell you is I've experienced the therapeutic use cases myself because it's so easy to experience it. The definition of immersive is that it brings you into this incredible world of therapy for veterans, but really we're starting to set the stage for the rest of American medicine on what this could potentially do. And what I love about immersive technology is that it's all benefit and very little to no risk. It is not invasive. It is not something that requires, in many cases, even for the veteran to come in to one of our facilities. If we're able to hand them a headset and deliver a really important type of therapy at home, this could be a really important way to extend accessibility of an effective therapy to veterans for so many different conditions. I just had a chance to meet the incredible veterans who were on a panel just now, I think, before coming on. Incredible stories, incredible people, their partners and spouses were with them. And I will just tell you, this is one of the main levers we are pulling on innovation to be able to deliver the next generation of therapy and improve the lives and well-being of veterans. We have veterans, by the way, in the driver's seat of this. Veterans who've been through mental health issues, veterans who've gone through trauma during their service, even before their service, and living with that trauma every single day. And I am most inspired by them because they see the value of this and they're telling their battle buddies and colleagues across the country what immersive technology can do. I do want to thank also Dr. Susan Kirsch and Dr. Carolyn Clancy. Even before I got here about 2 years ago, they were bringing this technology to the next level and extending access to it for veterans across the country. And at this point, we've handed out thousands of these headsets. And by the way, we are offering some form of immersive technology for various different use cases in every single VA medical center in the country. So a huge round of applause again to that team. Now look, I'm sure you've already heard and learned about the really exciting use cases with this, but I'll just tell you what I'm most excited about. I'm most excited about bringing veterans together with this technology. We know that peer support, and I've seen peer support work in so many different arenas of healthcare. Somebody who's gone through substance use disorder is often the best person to be able to get that veteran or that patient to a place where they're willing to start their recovery. Somebody's been through PTSD and has lived with the stigma and potentially denial of that condition for so long. I just recall meeting a veteran in Pennsylvania a few months ago who lived for almost 3 decades with active PTSD, hyperarousal symptoms, to the point where, for example, he went through 3 different relationships that were unsuccessful. He was at his daughter's graduation and was scanning the perimeter of the football field to, check for explosives. And, the way he described it was, I didn't even realize I was doing this until I was in the midst of it. And it was fear and it was anxiety that actually kept me going just to make sure that there wasn't a threat. And he was able to get connected to the VA because another veteran told him to do it. Another veteran who had gone through PTSD and connected to our care was able to do it. So imagine us scaling the power of peer support by connecting veterans to each other through telehealth, but also through headsets and immersive technology in ways that actually feels like that veteran is in a room with a group of other veterans. When I travel to vet centers across the country, one of the most emotionally impactful moments for me is to see veterans together who typically go through group therapy together for their trauma and for their mental health conditions. And when they tell me that, hey, this experience at this vet center in this group therapy saved my life. Imagine being able to scale that with relatively accessible and affordable technology that brings veterans together in a way that's more meaningful than just looking at a box on your monitor or your TV screen. You know, the fact is, immersive technology can be more therapeutic and can connect you to others in ways that are more meaningful than a flat screen. And so the ability for us to do more peer support and serve more veterans with mental health conditions, but conditions of all types across the country, that really excites me. And I'm also particularly excited about some of the evidence-based use cases that we're seeing already with things like phantom limb pain. When a veteran has to get an amputation for medical reasons or loses a limb in service in the field of battle, ultimately, we try to address every condition that they might have, and some of them end up having what's called phantom limb pain, this sensation that your leg is still there, and when your nerves are trying to find that leg that your brain thinks is still there, that manifests in pain. And just putting on augmented reality goggles and doing a mirror image of the other leg that's still there instantly starts to relieve the pain that veterans experience. So these are things that are exciting, they're innovative, and they could be really meaningful and just get veterans to the next level in their healthcare. So what do I think is the next step on this? Well, just as we've seen the pandemic compel telehealth as an accessible technology that, by the way, veterans of all ages and all sorts of literacy with technology are now using because the pandemic forced the issue to be able to get healthcare to veterans when they needed it during that time, when the whole world was shut down. I think we can achieve that with immersive technology too, because the way that telehealth is viewed now is not some kind of specialty care or alternative type of care that's inaccessible. It's just a part of your normal health care. You might need an appointment in person, or you might need a telehealth appointment that could satisfy all of your needs at any time. Immersive technology can be that. It can be viewed as a tool for any type of care that can be used at the right time throughout the course of a trajectory of care. And the more clinicians we train on how to use immersive technology, I think the more veterans will want it, because at the end of the day, everything we do depends on that transaction of trust between a clinician and a veteran, where the veteran says, "You've cared for me, I trust you, what should I do next?" The more clinicians who are trained and understand the benefits of immersive technology, the more veterans will accept it and use it to the benefit that the veteran panel folks just told you about. So I'm really excited about that. The fact that we're in every medical center means a lot. The fact that we continue to hand out more headsets and look at use cases for things like peer support is really exciting to me. But this will be part of our DNA, our clinical DNA in the VA, because it has been so impactful for veterans. I always start with a simple question on how we invest our time and our resources. And I'm here for a reason. I'm investing my personal time in this for a reason. And that reason is I've seen the benefit that this technology can have for veterans surrounded by our care teams, the best in the world, the best in the business at caring for veterans. And because of that, I will absolutely spend all of my time looking for these types of solutions, because we have to be at the tip of the spear and at the forefront of innovation for veterans. If we're not there with immersive technology, then veterans are not seeing the potential that they can see. And my job is to make sure that we're constantly pushing ourselves with the experts like Dr. Bailey by my side to make sure that we get there. So thank you all for helping us with our mission, for coming and exploring, especially for the veterans in the audience. I really thank you for your service, and God bless the United States of America. Thank you so much.